This podcast is for educational purposes only. Please consult your doctor before changing any medical care. This information, products, or comments contained within this podcast is not approved by the FDA for the treatment or diagnosis of any disease. Although we attempt to keep the information up to date and current, we cannot guarantee the information is up to date at the time of this recording. Individual results will vary. No one should expect the outcomes or results mentioned or described in this podcast. Health shares do not constitute health insurance and do not provide a guarantee to pay for your medical bills. Please consult your broker, general counsel, and/or doctor before changing your healthcare plan. Envita and Envita Health makes no guarantees for outcomes and results. Joining us, I'm Dr. Dino Prato, founder and CEO of Envita Medical Centers. I'm here with Dr. John Oertle, one of our chief medical directors, also works on the patient side of care. So Dr. Oertle, I'm going to try to ask some questions. This is another wonderful case, dramatic, huge tumor, neuroendocrine, typically doesn't respond well to chemotherapy. This patient does incredibly well. A picture's worth 1,000 words. The one that that really just shares the power here of the work that we're doing here at Envita. So this is a 49-year-old female, abdominal mass, a huge abdominal mass in the abdomen, a big tumor there. And we'll see what the pathology reveals that this is a high-grade neuroendocrine carcinoma. And I'll let you take it from there. And we'll go into some of the questions.
So this 49-year-old female came to see us, and she didn't even have a diagnosis yet. She's very natural. She didn't want to be able to go see the doctor. And she came out and she saw us because she was interested in what we could do for her. She knew that there was a big problem. And she literally had this about 20 centimeters by 20 centimeter pelvic mass in the lower abdomen. We'll get to an image so that you can actually see it. But it was literally taking up the whole entire abdomen. There wasn't room for anything else. And what you're seeing here is that it was blocking the kidneys from draining appropriately. And it was having all this fluid that it was leaking, creating a huge world of hurt for this dear woman. And it was very concerning. I know the doctors were all, when we had originally seen this woman, we were very concerned about her and her case because this was very highly advanced. And anything about neuroendocrine as well, neuroendocrine carcinomas, as you mentioned, very resistant to chemotherapy, very resistant to radiation therapy. And so conventional models just don't really work great for the neuroendocrine. But you want to know what does work well is immunotherapies and a real precision model of chemotherapy delivery. And so this is where when she came on out, she didn't have a diagnosis. Patients can come out to be able to that don't have diagnoses as well and just want us to be able to actually evaluate. We got a biopsy. We ran up the whole workup on her to be able to actually diagnose the neuroendocrine carcinoma through the biopsy and pathology. We'll go continue. This is also the other thing here too, is that was mentioning she also had really severe, because of all this fluid dynamics with all that blockade, she also had severe fluid accumulation within the lungs. So she had both lung fluid that was accumulating. This is what's called that pleural effusion that we were helping to drain throughout the course of treatment as well, just to keep her lungs open and breathing and making sure that her quality of life was being supported.
Just think about, these are almost 7-inch by 7-inch tumors, just to understand the translation. I mean, we're talking 20 centimeters, almost 7-inch tumor. This is a very large tumor for the abdomen. I mean, that's a very large tumor. So let's move on. I mean, it's exciting, the results on this. There's no question. This is this is just the CEA marker.
The CEA is a normal tumor marker that is commonly elevated in some cancers. And what you see, CEA, that's a very high level. Again, CEA is also related to inflammation and inflammatory responses. So there's an element of this, which is just, there's a lot of inflammation happening within this actual case as
you
well.
have a 512 LDH,
Yeah, very, very poor prognosis. And white blood cells of 19.3. There's already, there's elements of infection in this case as far as this goes, and an immune system that just doesn't know what to do, but knows that it's under attack and doesn't really know what to be able to make of it.
Here is the image, and you can see the enormous tumor here in the abdominal region. I
Okay,
mean, it's
so
just,
this is just disastrous, right? This is the first image that we saw of this case. What you're seeing you're looking at two images. You're looking at the left-handed image is an image that's looking to the side of the patient. So what you'll see is all of that area there. It's the backbone. You'll see the backbone. That's kind of the lightish air. That's more of a light area,
spine.
and then you'll
Spine.
see the glowing area that's a circle right there. That's the abdomen and the pelvis, and that's the tumor. And it's just that glowing area is all the active tumor that's taking up metastatic disease. And so the whole thing, even though that's a perimeter of where the cancer is active and growing, the whole thing is a tumor that is close to 20 centimeters. And what you'll see on the right hand side is you'll see this is the kind of the front and back of the patient, and you'll see that big ball right in the center of the lower abdomen. That is the mass, and you'll see the kidneys. The kidneys are those other two globs just to the top of it. And what you'll see, look at that, they're bigger than normal. They're not draining. And this is where the tubes draining from the kidneys are enlarged as well, because there's such a big mass that it's blocking those tubes from even draining appropriately to let the
And
kidneys
so what do you
drain and
do?
allow for urination.
So what does the patient do here? Neuroendocrine isn't necessarily great with chemo. The tumor is very large. This has got huge obstructive going on. You don't have any, surgery taking this on day one, right? Because this
No.
tumor is active. So let's see what happens here, which obviously it's a great story, but just to understand the power of, that the treatment program. So let's go through here, John, Doctor,
Okay, so
the treatment
what did
plan
we
that
do?
our
We
Envita
got
team put together.
What did we do? We got right to be able to give her direct chemo, immuno, precision injections directly to the core of the tumor and everywhere around where the tumor was active. Why? Because we wanted to be able to actually direct it. It's so large that it's difficult to get chemo even into that area. So we, with our interventional radiologist, we're deliver the right
So,
chemotherapy
so people
selections
would
and
understand.
immune system supportive adjuvants.
So, with direct injection into these tumors, we're delivering the genetic chemotherapy and immunotherapy right in. So, remember, when you give an IV, even with we did here with a genetically targeted fractionated, we need microdosing because we know what the genetic targets are. But when we get direct to tumor, we're sparing the body and we're focusing right where the cancer is. Because even if you give an IV, 5, 6, 7%, what actually gets to the tumor, right? It's not nowhere near the 100% delivery you get with Envita Sippy, which makes a world of difference. And as you can see in the treatment plan, Sippy is very immunotherapy centric, even though it is chemotherapy. So is the PD-1 inhibitor, and so are the adjuvants. There's so much immunotherapy here that you can't really see that this becomes a critical part of the treatment and the reason for the great outcome that we're about to see with this particular patient.
And even the
But
chemotherapies, a part of our algorithm is that the chemotherapeutic selections are that it works in conjunction with the immune system. Okay, so this is really important because I don't know another center that uses chemotherapy that considers what the chemotherapy is doing in connection with the immune system. And so this is where that is a part of this algorithmic approach to be able to actually look at what are the chemotherapies to be able to kill the cancer for you, and then how does the chemotherapies play in concert with the immune system in order to be able to not destroy the immune system, but enhance the immune system to be able to help better find its targets.
a lot of planning, and
There's a lot of planning
I would
involved.
say that the conventional drug planning in some ways is easier because you have only so many chemos. But when you get into the integrative agents, that's even 10 times more difficult because you have so much data and information to go through on all that targeting and combination. So that's why when we say
And
algorithms, we're
and we
talking
used
about
I was going to say we also use the adjuvant agents, the adjuvant treatments, the phytotherapeutics for the infusions, the nutritive support, and we used oral smart drugs based upon these precision
the
targets.
other
And we
thing
use
is.
everything in concert to be able to actually allow for this woman to be able to have the best supportive care plan that she could
Well,
possibly
and you
provide.
have to understand, it takes a doctor that joins Envita, even if they're a 10-year oncologist or a integrative doctor or a naturopath, whoever's on our team, 1,500 hours in 1 year of training to understand how to use these combinations for the patient. So I know we're simplifying it here, but there's a lot of work to it. And it is, everything is what you select. Everything is how you deliver it. That's just 23 years of experience. Let's move on here, though. I think that's very powerful. And what you're going to start to see is from right to left, you can see the markers dropping.
Let me share this too. There was not a doctor that I knew of that would touch this woman. When this patient came on out to see us, and I was working with, I was calling around to a number of doctors, and there was not a doctor that would want to even eat surgeons, other gynecological oncologists that even wanted to be able to co-manage this patient with Envita. And so as a result of this was literally, there was not another doctor in the conventional model that I knew of or that this patient knew of that went to see that would want to even touch her. And everybody was saying, go home and die. I could see the rationale, let's say, for these doctors with this kind of severe disease to be able to say, it's too severe, I won't do it. But when we started seeing and identifying that there was a roadmap of being able to have proper targets that we could actually deploy, and that there was a real significant way to be able to actually bring about a really good plan for this woman that included everything that we had just discussed, that it became exciting for me to be able to say, well, there's an option here. Let's see how this patient responds. And this is what we started seeing really early on.
This is what Envita does. It's probably, it's hard for me to know everyone, right? We don't know everyone. We know a lot of the people in the US and around the world in the work of oncology, but this is where we're not afraid to say that we are, at least from what we know, very unique to what we do, probably one of the best in the world. And that's why when we get these cases and we're telling you they're difficult, it's not a standard oncology group saying this is difficult. This is, we focus on late stage and difficult cancers. The sooner we get cancer patients, like anyone else, the better. This is a late stage cancer. You're already seeing here in the 12 weeks of this tumor marker, John, you can see all the way down to 3. I mean,
So what you're seeing here is wonderful. That on the right is when the patient, when the patient first came on in, and that's the tumor marker CEA. And it's very high. And what you see is that upon initially starting, it already started dropping, and then it literally bottomed out to a normal range. It was 3.
Powerful.
At only 12 weeks after therapy. This was beautiful. We were very excited to be able to see this response.
Now,
go to the next slide.
Take a look at this imaging. I mean, this
all
is
right. So this is now seeing all the metabolic uptake. On the left, you're seeing, don't forget, this is a woman that has literally a 20 centimeter tumor by 20 centimeter tumor in the pelvis. This is the image that she had upon initially coming in. She was not diagnosed by anything and didn't even have a pathology. We got the biopsy under Envita interventional radiology. We read the pathology. We staged her. We looked at this, and we actually were able to develop a precision plan based upon her own target. And that's the tumor on the left that you see in that big circular black mass. And what you see on the right, and this is in short time, we see that it's completely gone. Now, what this is showing, the tumor is still there, but it is dead. There is no uptake. All those other little things, the kidneys, that's showing the kidneys, the bladder at the bottom, but the tumor is showing there is zero activity.
This is really important for people to understand. So the cancer, the shape is still there, but it's dead, and you can't see it on the uptake. You have to understand this is such a large tumor that it needs to be excised. Now that it's totally dead,
correct?
It's dead, it's gone, it's totally necrotic, meaning it's died. Now our job became, as a team, here you're looking at within a 3-month window, this cancer is essentially completely cleared here in this patient, which before was a very dismal outcome. This is a wonderful response to precision care. Now the next step, John, if you don't mind sharing, the surgical part, because once we killed this tumor, now we had to get it out of there, right? It's very important to resolve the case for the patient.
Yeah, so there are some times that large tumors do absorb and resolve on their own. And so that's very possible. So it's not every time you have large tumors do you need to be able to get them excised. In this case, we needed excision. And so I continue to be able to call those docs that did not want to treat in my local area and didn't want to touch this patient. And they kept saying, I don't believe it. I still won't receive this patient. And so they refused to see this patient and they refused to operate to be able to excise this lesion because they just didn't believe it. And so they still refused to be able to.
They didn't
do
believe.
the surgical.
They didn't believe the outcome.
They didn't believe the
Because
outcome.
so I just want everybody to understand that this outcome was so strong and praise God, wonderful with the great outcome that the conventional surgeon said, "There's no way this person is treatable." Even after we, by the grace of God, our team took this cancer out, it's gone. They still didn't want to touch it because they didn't believe it was possible. This gives you an idea, and we see this a
And this
lot.
isn't just any surgeons. These are
No.
some of the best gynecological oncology surgeons in Arizona that refused to do this because they said, I don't believe it, and they refused. So we ended up having to be able to coordinate with, go outside of Arizona to be able to find a leading expert in gynecological oncology for neuroendocrine tumors to be able to accept this patient, to be able to actually remove it and excise that mass. She did accept the surgery, and the patient went through the surgery. I have to say, though, again, to be able to get that report from the neuroendocrine specialist, she goes, I don't know what you guys did, but it is absolutely remarkable. We sent that to pathology, and she goes, the tumor just had fallen out of the patient. And we sent it to pathology, and we looked at it, every little bit of that thing under a microscope, and there is not a live cancer cell anywhere in that whole entire tissue.
These are the kinds of stories you will not get in the media because it would just, you lose confidence in the conventional oncology system completely. Because when you're saying, boy, this was untreatable, difficult, complex cancer that's resolves, it's unbelievable. It really is things we do all the time with cancer patients. We do it with all different kinds of cancers because of precision targeting, by the grace of God, I want to add. And I think that this is where the proof is in the imaging and in the patient. They may not want to bring you these stories. They may want to bring you, a one-off patient that we treated who, maybe came late, and we do get those patients who respond a little bit but don't respond to care, or there are family complexities in those stories. But that's not the majority of Envita's patients. The majority of Envita's patients respond in one form or another under our care. And here's another example of the beautiful work, by the grace of God, that's going on in the clinic, and this woman having a long, 3 months. Look at the change to an incurable, terminal, all of a sudden to a treatable. It's a blessing, And so I like these stories because no matter how much you tell people about this, it's very hard until you see it. Really, the picture is worth 1,000 words. I mean, for the visualization on this is powerful.
It's beautiful. And I'll add, the patient is still in remission. And I always say remission because I never use the term cure. You'll hear, no, none of us at Envita ever use cure because, again, it's remission because there has to be a lifestyle change. Again, because you're different. You can't go back to the same environment in what you were before that created the cancer. That, again, the diet, the lifestyle, the ability of mental, emotional, all of this has to change. And I always say that to patients because it's so important, because those changes are critical so that you then can stay in remission and keep remission and continue to be able to stay in remission. Because the concern is that if you ever go back to the same environment, into the same things that created the cancer to begin with, then it's very likely.
So you're speaking about very important metabolic factors, which we're learning more about every day. For patients, we're learning that they're not perfect, right? Because you have somatic genetic changes that can occur. We have all this, but what I want to say is this cancer, just from years of Envita's experience, you're not going to treat this with just diet and lifestyle and eliminate this tumor. This needs proper treatment with precision on both ends. Now that the cancer's out, is making the dietary, moving the body to ATP, oxygen energy, decreasing the metabolic to improve the patient's other factors that are related to morbidity, whether it's cardiovascular, we know cancer, all these others that are related to comorbidities, and improving those, because those make a big difference. But what is powerful here is the precision technology going right to the tumor, killing the cancer, building the immune system, and this is the result. And so we have a lot to be thankful for here, and this is another wonderful story. So, John, do you have anything else you want to add, Dr. Lee? I just want to thank everybody for joining us. May the Lord bless you on your journey to healing. I hope that these cases we present are helpful to you and your loved ones. And reach out. We're here. We have people that can walk you through what our processes are, how we work differently. But precision matters. And I say that because it takes a lot of work to be here doing integrative care. You come up against the giants. It's like the David and the Goliath. The conventional model is the giants. The media is the giants. All these naysayers. But the outcome is the outcome. The picture's worth 1,000 words. The patients, we're here for them. We've been here for 23 years doing our work. And by the grace of God, we're going to continue doing it. So may the Lord bless you on your journey to healing. And we're here to help in any way that we can. So thank you for joining us again today.